breast implant, we won't know what the average life is for a long period of time. Because right now we know that the leak rate or the failure rate of a typical silicone breast implant is only about 1.3% in 6 years, average. So we're not going to see a huge number of failures, and therefore we're not going to know exactly how long they will last. One of the interesting recommendations from the FDA is that they would recommend that in order to diagnose a leak, they're going to recommend regular MRIs, magnetic resonance imaging, to look for leaks. Now we know that MRIs are good, but they're not perfect. There are false positives. And that we also know there are lots of patients that have perfectly good results, and now we're going to rely on the MRI to tell us whether they should have another surgery.
The FDA is recommending starting with the MRI at 3 years after the implant, and then checking every 2 years. Is that too much, in your opinion?
Well, as I said, if it's going to change the patient's decision making, then it's worthwhile. Meaning if the patient is concerned and says, if I find that the MRI tells me that I have a leak, I will have another surgery. If they tell me, well, you know, if I have perfectly good results and I know these implants are not going to kill me, then what is the purpose of the test? Because they're not going to have the surgery anyway. So I think you'll have to individualize it for each and every patient. And if you just present it that way and give them the option, then I think it's a reasonable thing to have it every 2 years if the patient is concerned about it.